Anxiety disorders. Module 2. Overview of anxiety disorders and risk factors. Anxiety disorders share a common feature: excessive, unrealistic, or unfounded anxiety that interferes with daily functioning. Unlike normal anxiety, these conditions are persistent and disproportionate to the situation. Anxiety disorders may affect thinking, behavior, physical health, and relationships. Nursing assessment focuses on symptom severity, duration, triggers, and functional impact. Anxiety disorders result from a combination of biological, psychological, and environmental factors. Risk factors include gender, being female, genetic vulnerability, neurobiological differences, exposure to trauma, chronic stress, and comorbid medical conditions. Certain medications and substances can also trigger or worsen anxiety symptoms. Understanding risk factors helps nurses anticipate needs and provide early support. Anxiety disorders include several distinct conditions, each with unique features, but all share excessive fear or anxiety that interferes with daily life. Separation anxiety disorder involves developmentally inappropriate fear or distress related to separation from a significant attachment figure. Panic disorder is characterized by recurrent, unexpected panic attacks, often accompanied by fear of having additional attacks. Agoraphobia involves fear or avoidance of places where escape might be difficult or help may not be available if panic symptoms occur. Specific phobias involve intense fear of a particular object or situation, such as animals, heights, or medical procedures. Hoarding disorder is marked by persistent difficulty discarding possessions, leading to clutter that interferes with functioning and safety. Social anxiety disorder involves intense fear of social or performance situations where the individual may be evaluated or judged by others. Generalized anxiety disorder is characterized by chronic, excessive worry about multiple areas of life, occurring more days than not for at least 6 months. Other anxiety disorders include substance-induced anxiety disorder and anxiety due to a medical condition. In these cases, anxiety symptoms are secondary to physiological processes and must be addressed by treating the underlying cause. Although post-traumatic stress disorder includes anxiety-related symptoms, the DSM-5 classifies it as a trauma and stressor-related disorder, which is addressed in a separate lecture unit. Why is it important to rule out medical and substance-related causes before diagnosing an anxiety disorder? It is important because many medical conditions and substances can mimic anxiety symptoms. Without proper assessment, this can lead to misdiagnosis and ineffective treatment. Identifying the underlying medical or substance-related cause ensures that the anxiety symptoms are addressed appropriately, and that potentially serious conditions such as cardiac, respiratory, endocrine, or neurological disorders are not overlooked.